So reviewing the lungs of this person that I suspect would be COVID positive once we get electron microscopy or immunofluorescence. But you can see some desquamative cells right here in some of the alveolar spaces here. And as I peruse around, we're going to show you some fibrin deposition within the alveolar spaces. Here's one right here, as well as fibrosis along the alveolar septae. But you can see that this is very damaged lung that one would see in acute advanced stage lung disease like in ARDs, which is often associated with the final stages of pneumonia or COVID atypical pneumonia. But I'm going to peruse around first before I go down to show you views up close regarding the cells. There are some cells that actually look like they have viral cytopathic changes, but that can't be confirmed, particularly with the person being tested 3 times with COVID negative test. So we now have to rely on electron microscopy of a sample such as this to see if we can bring out the viral particles or some evidence that there are some viral infections here. But you can see that this lung is severely damaged in a person who presented with cough and fever and antibody tests. I'm just perusing around right now. Bacterial cultures were negative. But again, he was tested negative for COVID as well by immunology and PCR. And you can see, and I'm going to go down and show more details of the cells, but I just wanted to kind of peruse around it just to give you the gestalt of just how damaged this lung is. Just no way you can breathe through this sort of, and some of this is collapsed, no doubt, but others, you'll see as I peruse around that there's definitely some damage, some fibrosis within the alveolar septal wall. And I think you can see a lot of proteinaceous. That's the other thing that's have been characterized with the pathology of COVID-19. You can see some proteinaceous material within the alveolar spaces themselves. You see foamy cells, you see the inflammatory cells, and as I go down, you'll start seeing some of the immunoblastic appearing cells. Obviously, there are some type 2 pneumocytes that are also desquamative, just falling off into the alveolar spaces. I know this is a lot of medical and pathology terms, but I'm throwing them out there so you can go and read about them. But let me just go down to the cellular component so we can highlight some of the findings that I think is present here. All right, so and also I want to stay on this power actually for a little while longer, because there were some syncytial cells, multinucleated smudged or syncytial nuclei within some of these. Here's one here. Let me just go down and show you some of this stuff that I'm talking about. And like I said before, we will go in and out of focus. So, for example, here's a cell in the center that I'm trying to put in the middle here. Now that could be either a viral inclusion cell or it could be some sort of a reactive histiocytic cells. It's very difficult to say, particularly not having definitive evidence of COVID from a serology test. But again, I think some of these cells will probably be infected with viral particles. Here's one right here. Now some of these look like they may be immunoblast immune type cells, so it's kind of difficult to say. Some of these are histiocytes, but there's a smudged syncytial like cell right there. There's one there that I brought in the center, was at the 12 o'clock position. So I'm just going to keep on perusing around as you see these cells up close. So again, some of these are just desquamative cells, and some blood vessels there. I thought I had a better view of some of these syncytial-like cells. I mean, here it could be a potential viral infected cell as well. You see the clearing of the nuclei, vesicular nuclei with prominent nucleoli. That could be a viral infected cell. It's difficult to say, but let me keep on perusing around. Look at the fibrosis along the septal wall. That's good evidence of ARDs there, And let me see. I just want to keep on perusing around at this power, see if we can get see some more syncytial cells as I continue to peruse around. But this is definitely damaged, acutely damaged lung tissue. No way you can breathe through that. There are some syncytial cells there coming in and out of focus there. See the little darker cells are smudged together. And let me just keep on perusing around. You see more fibrosis here in this lung. That's definitely some fibrosis there. Alrighty. Okay, there's and they're right there in the middle of the field now, and also right there potentially viral infected cells. Again, this would be brought out by electron microscopy. But you can see that this lung is severely damaged, and as I suggested in my report, I'm interpreting these findings to possibly be represented. Here's some more smudge cells here, syncytial cells and smudge cells, possibly related to COVID-19. All right. Now, see that's a clearing of nuclei right there. Those that could be potentially infected viral cells again, which will require, again, electron microscopy. Thought I had some better sections of, there's some more syncytial cells right there in the middle. Yeah, those darkly stained cells there. And yeah, some of these cells look at the one in the center there. I'm going in and out. You see how the cytoplasm is cleared around the nuclei. That's possibly a viral infected cell there. And again, I believe will be brought out by electron microscopy. I think I've demonstrated enough of this pathology here. You can see how the veal, there's enough scarring fibrosis. You can see how difficult it would be for oxygen to get between the velar space and the capillary space. And there's some more desquamative cells there that I think we had already passed by before. And then the pigment is just the anthracotic pigment. Again, if you live in the city, you're going to have some anthracotic pigmentation. And I sampled a few lymph nodes as well. Look at that, that's more like a viral infected cell there. I sampled some lymph nodes in the hilum, and they showed necrosis and also viral features consistent with viral lymphadenitis. And so did the spleen. Here are some more desquamative cells there. But this is not tumor cells. These are just desquamative cells from the lining of the alveolar space and the bronchial cells. Not bronchial cells, but the alveolar spaces. That's quite a bit there. But these are not tumor cells. These are desquamative cells. All right. I think that's enough.